Hi guys, thanks for tuning in for this lecture. So much good information here. You're going to see in a minute, there's going to be maybe two different settings, and what I did is I recorded, I watched, and I decided to do an overview. So about the last 5 minutes of this is an overview, so you can either fast forward to that or watch the whole lecture. I know it's a little bit longer than some of my other classes and lectures, but the body is going to give you a lot of the information, but about the last 5 minutes is going to be a recap or an overview. So I hope you enjoy, and if you want to get to that overview quicker, just look for the portion where I'm not wearing sunglasses. You'll know what I mean. All right, good morning. Today I'm going to talk to you guys about intestinal permeability, which is also known as leaky gut. And so I want to start off by saying my health talks are designed to be informational. I always tell my patients that take the information here and go do further research with it. Don't just base everything that you're learning on that. Don't replace what other doctors are telling you. Just take this information and be able to apply it to your own decision making. Everything that I talk about, there are plenty of scientific papers out there. There are doctors of all professions, medical doctors, DOs that are doing ongoing research, and this is the newest research. And so there's a good likelihood that you may not have heard of this. But take this information, build on it. I'll try to give you some resources along the way. And from there, just be more empowered with your own decision-making process. So what leaky gut looks at is really how it affects your cellular system, or how your lifestyle may affect your cellular system inside your body. Instead of just having some slang term, I want you to understand why, because once again, this is a very important topic. So I guess where I'll start is there's an ongoing study by the World Health Organization. It's called the burden of disease. And so what the burden of disease looks at is it's going to look at the top healthcare conditions out there, and then how those impact our society and individuals' quality of life. It looks at the cost, and really puts those top killers or top conditions that may impact a person's quality of life in order. And so if you look at the burden of disease right now, what you'll see is the top conditions are going to be heart disease, diabetes, cancer, and dementia. Also spinal pain fits in there. That there's a lot of burden from spinal pain. If we look at also some of the information, the United States ranks pretty high in the countries in the world, and there's other information on that, maybe for a different health talk, but we are impacted quite a bit by the burden of disease. And so what I look at this point is, well, what's going on with all these conditions? What might be a common factor? And it is actually pretty clearly defined that the common thing that all these conditions have is going to be inflammation. So inflammation in the body is like a fire in the house. It is extremely destructive, and it will really impact the way your cells function, pretty much all your tissue, blood vessels, nerve tissue, the actual cells, your immune system. And we're going to get into that a bit so that you have some more of that information. So where I'd like to start is with digestion and leaky gut itself. Understand that a little bit better. So the whole goal of digestion is to break down the foods that you eat into the smallest little particles that your body can absorb through the intestinal wall. And so those are going to be your individual amino acids. And what your body does is it takes those amino acids and then pulls them into the bloodstream, and it rebuilds hormones, your own tissue. It builds what it wants. It basically sustains your body's building and life through these amino acids. So those need to get into your bloodstream, but the important part is that only those should get in your bloodstream, not other things. And so we'll start with digestion in the mouth. And so when you eat your food and you start chewing it up, you start to break it down. And so a great analogy I've heard along the way is comparing your food to almost like a book. So when you first take your bite of food, think of a book with all the chapters and the paragraphs and the sentences and the words. And in your mouth, it's almost like taking that whole book and you start to break it down into the individual chapters. And so you have digestive enzymes in your mouth, and that starts the breakdown process, and you really start to break this down. So from there, the food goes down your esophagus into your stomach. And that's where it's very important. And I could do a whole side talk on this, which I will, and put in the links below, but your stomach acid should be extremely powerful. And that's going to be one of the places that people already start off, because so many people have a stomach pH that's off. But when you have the proper stomach pH, the food churns around in your stomach, and that breaks these protein molecules down more and more. And so with our book analogy, we could start to look at down to individual pages of words, and then even paragraphs, and maybe even into sentences. So from the stomach, the food dumps out into your small intestine, and you have digestive enzymes that hit it from there, and now we're really breaking down. And by the time it hits the small intestines and starts moving along through the small intestines, we should be getting pretty close to individual letters as those digestive enzymes do their work. And in health, that's exactly what you want to see. Your intestines are about the size of a tennis court, so a huge surface area. And essentially, the food as it passes through, your body should start to grab those individual amino acids, the smallest portions of the proteins, out and be able to utilize those and build your body and your tissue from those smallest parts. And so that's where we start to get into what happens here in the gut. And so as we talked about, your gut surface is huge. One of the things a lot of people don't know is that the actual gut lining is only one cell layer thick. So you only have the size of a cell separating from, essentially, in the center of the tube of your intestines is the outside of your body, and then in your bloodstream is on the other side of that cellular wall. And so you have a barrier which is blocking basically what's in here from getting in here. And there's a whole lot of stuff that's in here that would be a problem if it got into your bloodstream. Your blood should remain sterile, and if it does remain sterile, your body usually doesn't have a lot of the reactions, a lot of the things that we mentioned earlier. So we mentioned the top burdens of disease, and then a lot of other symptoms can arise too that we'll talk about here in a little bit. And so once again, if this barrier becomes breached, we will talk in a few minutes about the reasons that would happen. Now, different things from undigested proteins, that's going to be what the P represents there, and then different bacteria. And we're going to talk about one specifically problematic bacteria, and that's one called lipopolysaccharide. And this is well studied, and it's normal to actually have that in your intestines. And if it's in the intestines, it's not a problem at all. It's when this starts to pass through into this sterile environment that this well-known what's called antigen, which means it is something, it's a foreign toxin in your body that stimulates an immune response. This guy in particular actually does a lot with driving up inflammation at quite a rate. And so it's very, very problematic if that guy gets into your bloodstream. Some of the other things that can get into your bloodstream are going to be these undigested proteins, and I'll talk a little bit about this down here in a few minutes, but then also virus, bacteria, parasites, some of those things. So to keep what should not be in your bloodstream in your gut is a very important thing, and then when we develop leaky gut, that will get into the system. So I will mention that over 70% of our immune system is actually in the gut. And so we have what I would like you to think about is an immune system that regulates inside the gut, which really has a big influence on the gut wall itself. But then also we have an immune system that surrounds the gut lumen or in the intestinal wall. And its job is to make sure that if there are irritational things that get into the system, that it regulates that. And so this is where everybody's a little different. You are your own unique individual, and so some people are more sensitive than others. And so there's a thing called oral tolerance. I won't get too far into that, but what this is in your gut, the immune system, so in the actual inside the intestines, that says, okay, well, if some of these undigested proteins make it down to the intestines, how much of this can I handle before the intestines start to get irritated? And so if you start to go past that tolerance and you start to get irritated, that's where your gut wall will actually start to open up and become more permeable, aka the whole leaky gut situation. Once again, I won't get too deep into the details here. There's lots of information out there, but we can either have things leak in from between the cells. There's certain conditions that stimulate that, which we'll talk a little bit about, or actually right through the cells. And so either way, it's going to be a big problem if it gets into the surrounding tissue, some of the bloodstream there, but your body still does have a defense, so that's why it's important that you have a strong immune system. And from there, each individual is going to be different. The big problem comes in if, and it's typically due to either sensitivity or how much of something that your body doesn't do well with, how much you're exposed to that. If this keeps getting worked on and worked on and worked on, eventually that can pass into what's called the portal vein. And the portal vein is one of your big blood vessels that takes some of the blood up to the liver. And this is where we really see things become problematic, is if these different things from undigested proteins and then the lipopolysaccharide, that antigen bacteria, gets into the liver, that's where things go full systemic. And that's where we can actually see a lot of the conditions that I talked about are going to be impacted by this. And so, once again, don't take my word for it. There's tons of information out there, and that's the beautiful thing about this day and age, is that you've right at the tip of your finger, you can look at this stuff. So a simple thing to search is the systemic effects of lipopolysaccharide, or LPS. Just put that in, and you'll see article after article that links this information together. So once again, the LPS is going to be a powerful antigen, which means it upregulates your own immune system. And in the same way, some of these undigested proteins, if they get through, they can affect the body at the same level in the intestines. So what we can look at with the undigested proteins is that your human tissue and then some of the foods you eat may really look a lot alike. And so this is where you're going to have a little bit of variance within your own genetics. But this is an example here of corn, and this is actually out of the literature. And so your sequencing may look a lot like the sequencing of corn. So what happens is that either in the intestines, which can cause some of the inflammation or some of the leaky gut in the first place, or when it gets into your bloodstream and hopefully not fully systemic, your body will start to recognize this, the corn, is almost like a foreign invader. It says, well, why is this here? It shouldn't be here. I don't like this here, so I'm going to build an immune system to that. And so your body starts to build immune cells, and then you start to look at the human tissue, and those guys look a lot alike. It's called mimicry. And so what your body will do is actually build an immune system defense against some of the stuff that gets into your blood. And at first, it's sitting there and it's battling against whatever gets in your bloodstream. But down the road, it can start to look at systemically some of your own human tissue and say, hey, that's not, I recognize that, and it goes to attack on your own human tissue. And so a whole lot of different conditions can arise from this. So what some people may experience at this point is this is where symptoms might start to arise. So a lot of times people will develop indigestion, gut issues, but it goes well beyond that because some people have symptoms, and especially some of your more sensitive individuals. And then there's also those individuals that you can't compare yourself to that seem to have that iron gut, that they can eat whatever they want. And they're not completely in the clear either, because some of these things that we're going to talk about can affect them. And some people will have full-blown symptoms and may just think about related to the gut itself, but others may have different things like some of the things that are linked through the literature are going to be asthma, skin conditions, psoriasis. Some of the other ones are going to be brain fog, depression, anxiety, even things like suicidal thoughts, schizophrenia can be linked in. And once again, going back to driving up inflammation, that's what starts to happen. And there's all sorts of, you can watch any commercial on TV of things that should take care of these symptoms, but at the root cause, if you're still allowing some of this irritant to get into your bloodstream, all you're trying to do is patch a hole in the wall, but you keep coming through and hitting it. And so what you got to do is get rid of the hammer, quit hitting the wall and beating up the wall, and that way now when you go through to patch it, it's a much more effective strategy for your overall health. Now that's one thing to consider is the people who have symptoms, but something that has to be mentioned is there is a whole nother group of people, and it's hard to actually say how many people this affects because this is relatively new study, but there's a group of people that actually start to build a silent phase army. And so there's plenty of information about people who have a long silent term or era, which can be up to 10, 20 years long, where your body, if you remember, what's getting through into your bloodstream affects really how you make your own tissue. And if you're making tissue that's inflammatory, and then you have an immune system that's slowly building up to these foreign invaders, it's not until a stressful event that people tend to have a full-blown attack. And then depending on what your tissue in your body is made of, depends on how well your body can handle the attack and what the outcome of that attack is. And so recently we've all heard about the cytokine storm. And so what cytokines are is those are chemical messengers in your bloodstream that regulate your immune response. And so if over a 10, 15, 20 year period of time, your body's slowly building up, even without symptoms, this immune system army, it takes a stressful event to set this off. And so there is plenty of information out there. Once again, I'm not going to try to tell you from the standpoint of a rheumatologist or whatnot, but essentially what happens is that when that immune system gets triggered on, it can just go to work on your body, and your body has a very hard time shutting it off. And in some cases, with the cytokine storm and with autoimmunity, your body just doesn't ever really seem to fully recover. And so what I think of is that's where it got too far beforehand. That did not happen overnight. It's not like you had a perfect cellular system one day and then you woke up and boom, now you've got full-blown autoimmune system. But at the same time, it is what your body is continually making its cells from that influences and impacts this. So examples of things that you'll see in the literature are going to be things like the cytokine storm itself, where the body goes full-blown attack on itself, or other autoimmune conditions. So I've seen it with patients in my office where somebody has a very stressful event. So usually some of the ones that set these things off are divorce, loss of a loved one, loss of a job, things that are extremely stressful, and then somebody's immune system just goes off. And I've seen it where people have lost all the hair on their body and they go into that type of attack. Skin conditions can start to form, and really every single individual is their own unique individual. So what happens to one person is going to be different, and the severity and the amount of buildup is going to be different than the next. Another great example is Hashimoto's, and so that's a well-known condition that I see plenty of women experience, where the immune system after pregnancy, which is a great situation, but it's also a very stressful situation on the individual, the immune system, which would have typically built up over the years, goes to attack on the thyroid gland, and then the thyroid gland develops what's called an autoimmune Hashimoto's disease. So my goal, once again, is not to tell you that you may have these things, but at the same time to understand the basis and then be able to formulate your own questions, do your own research, go talk to your doctors about this, because there's a whole different angle of solution that lays within this. Circulating lipopolysaccharide is you have different cell receptors in your body, and some of these receptors are actually called toll-like receptors. That's not the important part, but you have these receptors all over your body. And so the lipopolysaccharide, LPS, has an affinity to these actual receptors, and this is where it will start to go to attack on these, almost like termites in the house. and over time can start to change the structure of this tissue. And so I know nerve tissue is one of the ones that's highly attacked, but then at the same time, your organs of elimination, which is going to be skin, liver, lungs, kidney, and colon. And so what we look at is the different conditions that we've seen a dramatic increase in over the last 20 or 30 years. And so not all of science will piece this together, but we see skin cancers that have been on the rise. We see liver, non-alcoholic fatty liver is one of the things which can develop into liver cancer for people. Lung cancer in people who haven't smoked. Colon cancer is huge nowadays. How many people are getting diagnosed with a colon cancer? And it's like, well, why did you get this? Well, I don't know. It's just your genetics. Well, maybe it was what the environment was exposed to your genetics. And so the good news is there are tests that can be done. Another place that LPS is going to attack is injured tissue. So some people I've seen through my practice is they have joint spaces that are breaking down faster than they should. And you'll look at one person the same age as the other, and somebody's joints are destroyed. So that individual may have more of a sensitivity to this stuff on one of the different tissue types in the body. Once again, the good news is there are actual blood tests, and they're very specific blood tests that can be run to show, do you have the circulating antibodies for some of these things, and then are your tissues either partially, so under symptom or subsymptomatically being attacked, or is your body having a full-blown attack to some of this tissue through your immune system? So great information to know. I hope that helps. And I guess what I'll move on to now is, well, we have all this information. We know that this cellular process can definitely impact our overall health. So what are some of the triggers? And so we start to look at triggers. One of the main triggers is going to be dysbiosis. I guess I'm going to mention all the main triggers. So dysbiosis, you're going to think about your gut flora, so your quote-unquote microbiome. And when people think of taking probiotics, you're feeding the bacteria that are in your intestines, kind of like the bacteria lipopolysaccharide that should stay in your intestines. And so if you start to, certain people will be prescribed repeated doses of antibiotics. That's going to throw off this gut flora. Repeated steroids, some food additives, things like that will really start to disrupt. And this is common for a lot of people of the origin of why they're going to form this leaky gut in the first place. Other things are going to include stress. Stress is a huge one, and concussions is another one. And you'll sit there and think, well, really, concussion? I have a concussion, I'm going to get leaky gut. Once again, real easy to go to your phone and type in concussion and leaky gut, and you'll see within 6 to 10 hours after a concussion, your gut membrane will become permeable. So stress, either psychological or physical from heavy endurance athletes, can start to affect the brain. The brain communicates with the gut through the longest cranial nerve called the vagus nerve, and if you start to lose what's called vagal tone, your body can actually start to develop a leaky gut, and a lot of times it will do this for people. And then another big one, as we talked about with the proteins that haven't been fully broken down, is going to be digestive, food intolerances right there at the gut level. This irritates the gut lining, and when the gut becomes irritated, inflamed, these cells will start to open up, and that's where we can actually see some of those undigested proteins, bacteria, parasites, molds, things like that get into the bloodstream. This is not ideal for overall or long-term health. That takes care of more of the vagal tone, things of that nature. One of the other ones I'll talk about for food intolerance is going to be gluten itself. So gluten is a very inflammatory, irritational substance to a lot of people's bodies. So a lot of times the doctors will test one portion of the gluten protein, and check you for celiac. And so people say, well, nope, I don't have celiac disease, so I must not have a problem with gluten. But there are multiple other portions of the gluten protein that people will have an intolerance to. So they're not gluten allergies, but they're gluten intolerance, and that intolerance will affect the permeability here at the gut, driving that intestinal permeability, aka leaky gut. Once again, gut starts to open up, things get into the bloodstream, which should stay sterile. Your body's immune system is going to have a hard time with this until it gives up, and then when it goes full-blown systemic is where we can see that as the foundation to a lot of these other health conditions that will arise. So building inflammation in the body is actually going to show up different. So you'll have the systemic inflammation, and clues that you can start to look at to know if you do is looking at some of your different organ systems. So in the gut, you're going to see inflammation showed up as things like indigestion, gut problems, acid reflux, things of that nature. In the joints, you're going to see things like joint pain. In the brain, that's going to be one of the places that's really affected by inflammation, and it does not like it at all. And that's going to be things like focus, attention, concentration problems. And left long enough, that's where people start to shift into more of an insomnia, depression, anxiety, more of those types of symptoms. So if you do start to develop these, and I'm not talking about, oh, you didn't get enough sleep one night and you're feeling some of this the next day. No, we're talking about if this becomes the new trend, the new norm for you, there are very good chances that you're experiencing systemic inflammation, and then even some of the other attacks on the body from some of the different stuff that could get into your bloodstream are definitely possible at that point. So what we'll do is I start to look at from here, well, what do we do about it? And there's a couple different steps you can take. And so the first step is going to be something simple like a system survey. And what that'll be is typically somewhere around 100 questions, and they have them. You can print them out from online. We give them to patients in our office. But basically what you do is you fill out all these questions. And some of the questions may look to overlap, but what it does is it gives the doctor some insight into what systems may be struggling in the body, and it's not one answer that you fill out gives us the solution that we're looking for or the answer we're looking for, but what it does is it lets us see trends inside the body, so we could say, all right, well, it's starting to look like this. System surveys are not the most specific tests that can be done, so what we would look at from there is going to be getting into things like the actual blood work. So there is specific blood work. It's not, I've had so many patients come in and say, nope, I just had my blood work done 3 weeks ago at my doctor. This is very specific blood work. It is very reliable blood work. So there are blood tests that can be done to look at if you have leaky gut in the first place, and then even looks further into what your reason may be. So depending on the answers from the blood work, we could say this is more stress-induced, this is more dysbiosis-induced, this is more food intolerance, that there's likelihoods there. So we can really start to break down what steps do we need to take next. You can look into the bloodstream and actually see, do I have circulating antibodies? What are these antibodies from? Is it going to be from food particles, things of that nature? And then even a whole bunch of the different tissues in the body that I mentioned, from the skin to the thyroid, pancreas, to the brain. Do I have a building attack on this tissue? That can be measured. And then also, do I have a full-blown attack? So with this information, now you can really see where leaky gut can impact and does impact people's overall health. Not two people are the same, so everybody's going to have a little bit of difference there. And the big thing is that due to your own genetics, you may follow things in more of a family type trend. So if your parents have something, you're exposed to that, your likelihood goes up at that point. But the tests can be done. You can really start to narrow down what's going on with these conditions, because we go back to the beginning of the talk, and that burden of disease, you see a lot of overlap, and the tissues involved with when your cellular system gets disrupted,
there's a lot of overlap there too.
Here's an overview on the information that we talked about today and a couple extra points and things to think about. So your body is built from what you eat. And especially in America, we eat foods that are highly inflammatory. So processed foods, processed oils. I've lectured on this plenty of times in the past, and I will put some links below for more of these talks on lectures with your diet and what would drive up inflammation in the body. But inflammation destroys the tissue in your body, from nerve tissue to organs to blood vessels. Inflammation's like a fire in your body. And so if you compound this with letting other things that we talked about in the lecture get into your bloodstream, this really accelerates the process. These different antigens, undigested proteins, this will accelerate the damage to the tissue in your body. And so when your body starts to change from nerve tissue, you can look at proteins changing and plaque formation starting to happen. So certain conditions linked with that. When you look at your blood vessels, obviously, and some of the organ systems, you can look at things like our burden of disease, heart disease, diabetes, cancer, all of these types of things. And then also some of the psychological disorders, psychiatric disorders that will happen if there's chronic inflammation in the brain, and especially if you ramp up the immune system to join in this essentially attack on the tissues of the body. So my license is Doctor of Chiropractic. I have an additional study in functional neurology, and so I was fortunate to have an instructor, a mentor, multiple mentors, but that led me in the direction that said you cannot fix the brain and the nervous system without first fixing the cellular system, and that's most efficiently done through the gut. And so if we look at things like a lot of the conditions we talked about, you're not going to sit there and adjust those away with a chiropractic adjustment. You will be missing a piece of the puzzle if you simply think you're going to adjust somebody and those things will go away. And so that's where, as doctors, as chiropractors, as really any healthcare professional, you need to take this stuff seriously and you need to explore these things for your patients. Otherwise, you're going to be missing huge parts of the puzzle. So a lot of the information that I talk about, I want you to go get your own research, your own information. And there's Dr. David Perlmutter. He wrote the book Grain Brain. Phenomenal book. Tons of studies. These guys are pioneers, him and some of the scientists that he's worked with. Also, there's Dr. Mark Hyman. He has a podcast called The Doctor's Pharmacy, spelt with an F, like the word farm. More and more information. They're going to really link in how you're going to see autism, allergies, breathing problems, all around, inflammatory conditions. All of this stuff is linked into what we talked about today. We're even seeing, obviously, the autoimmunity and then dementia. Dementia is going up like crazy. It's supposed to triple within the next 20 years. And so a lot of these conditions, the studies have been done, the research has been done. If this is the first time that you've heard this, that's unfortunate, but our healthcare system, really probably my best explanation of why is this information is too new and there are systems in place. Doctors' offices are set up in a model to basically get people in and evaluate them in a systematic form, and this takes more individualized approach. And so that's what we do at our office. I'm actually happy to be a part of an integrated office which looks at really the whole cellular function. We can do the blood tests because we have a medical doctor and great practitioners that think the same way, but you have to go to these deeper steps of evaluation if you really want to help solve these problems for people. So tons of good information out there. Do your research. Hopefully this is helpful and will help impact you and your family, and really don't wait until your body is broke down enough. Our system tends to wait until you're at a place called end-stage pathology, or develop a tremor, or have blood sugar that's so high that it needs to be regulated by medicine, which is really not a great solution in its own right. But don't wait till you're at a point where your body's halfway broken down before you even start to explore these things. If you have these symptoms, if you have anything that's going on in the body that you're just like, that doesn't sound right, find somebody that can help you explore this stuff. Talk to your doctor. If they kind of slough off the whole leaky gut idea, then maybe go find guidance elsewhere. So once again, hopefully this is great help to you and your health, and I hope the best for you and your family. We'll talk to you guys soon. Thanks.